Hi friends, today we will discuss about how to approach ABG. First of all, we should know some normal values. pH normal range is 7.35 to 7.45. PaCO2 normal range is 35 to 40 mmHg. Take this value. HCO3 value is 22 to 26. Take this value. Then move further. Step number 1. First we should check acidosis or alkalosis. pH value less than normal, it is a acidosis. pH value is more than normal, it is a alkalosis. Secondly, we should check pH value direction and PaCO2 HCO3 direction. Both are same direction, it is a metabolic. Both are opposite direction, it is a respiratory. Let's see some mnemonic. Rome. Respiratory opposite, metabolic equal. That's simple. Before moving further, let's see one example. pH value is more than normal. It is a alkalosis. PaCO2, HCO3 value are increases. pH direction also increases. Both are same direction. So it is a metabolic. Diagnosis is metabolic alkalosis. In normally, if metabolic alkalosis occur in our body will try to compensate to respiratory acidosis. How to check it? It is a compensation or not. In given example, our diagnosis is metabolic alkalosis. Compensation is respiratory acidosis. Normally, respiratory indicate PaCO2. So, we should calculate expected PaCO2 value. Expected PaCO2 value is calculated by using this formula HCO3 plus 15. Applying for this formula, HCO3 level is 40 plus 15 equal to 55. Expected value PaCO2 is 55. In our question, PaCO2 value also 55. So both are equal. So a final diagnosis is metabolic alkalosis with compensatory respiratory acidosis. It's a final diagnosis. If given PCO2 value more than expected value means final diagnosis change into metabolic alkalosis with additional respiratory acidosis. If given value less than expected PCO2 value means final diagnosis is metabolic alkalosis with additional respiratory alkalosis. All other cases you have to apply for this formula like that. Let's see causes for metabolic acidosis. Normal anion gap metabolic acidosis caused by renal cause and GAT cause. Renal cause due to renal tubular acidosis and drug induced. GAT cause due to diarrhea, it is most common cause. Then intracutaneous fistula, pancreatic fistula, uterosigmoidostomy. High anion gap metabolic acidosis caused by firstly ketoacidosis due to DKA, alcohol, starvation. Secondly, lactic acidosis. Finally, renal failure. Then move further. Let's see metabolic alkalosis causes. Number one, hypovolemic cause. It's due to diuretics, vomiting, bile tube aspiration. Secondly, hypertensive cause. Primary hyperaldosteronism, Cushing syndrome, renin secreting syndrome. Finally, genetic cause. Genetic cause is Bartter syndrome, Littleman syndrome, Gentleman syndrome, and Liddle syndrome. Then move further. Respiratory acidosis causes type 2 respiratory failure. Then respiratory alkalosis causes mostly occur in critically ill patients and panic attack patients. Normally, if aspirin given, respiratory alkalosis will occur. If aspirin give high doses, will occur respiratory acidosis. If metabolic acidosis is present, then we should check blood anion gap. Blood anion gap normal value is 10 plus or minus 2. If anion gap values increase than normal, it is a high anion gap metabolic acidosis. High anion gap metabolic acidosis caused by ketoacidosis due to DKA, starvation, and alcohol. Secondly, lactic acidosis. Lastly, renal failure. If anion gap, blood anion gap is decreased than normal, it is a normal anion gap metabolic acidosis. It is also called hyperchloremic metabolic acidosis. If normal anion gap metabolic acidosis present, then check urine anion gap. Urine anion gap normal value is 0 to 5 normal value. If urine anion gap decrease GAT cause is present, most common cause is diarrhea. If urine anion gap is more than normal value, it is a renal cause. Most common cause is renal tubular acidosis. Thank you for watching all.